Cold laser frequently asked questions. How do cold lasers reduce pain? Cold laser therapy is an effective, natural, and safe analgesic pain reliever. It increases blood circulation and speeds healing. It also stimulates the release of numerous pain-killing enkephalins and pain-blocking endorphins, such as dopamine and serotonin. How long have cold lasers been used? Cold laser therapy has been used for over 50 years for pain relief and accelerated healing in most countries worldwide. Over 6,000 clinical studies prove its efficacy in treating numerous symptoms and conditions. Albert Einstein played a role in creating the first cold laser in the 1960s from a red ruby. Who is cold laser therapy for? Cold lasers and therapeutic lasers are used by people in all walks of life. They're used by most healing professions, such as chiropractic, physical therapy, podiatry, veterinary, dentistry, sports medicine, and home users. Almost all professional sports organizations use cold lasers to reduce the severity of injuries and greatly speed recovery after injury. They are also used as a preventative and for performance-enhancing capacity. Tens of thousands of private practices, clinics, and hospitals use lasers, as do animal care facilities and horse and dog racing organizations. How often should I use the laser? For most conditions, it's adequate to use the laser 2 or 3 times a week. More often is not necessarily better. However, there are some chronic conditions in some people that require more energy and can benefit from owning their own laser and using it daily and for longer periods of time. Can I cause damage using my laser for too long? In most cases, the answer is no. Since we're talking about light, the body simply uses what it needs. Thus, if you use the laser too long, you will just waste your time. There is some evidence suggesting that you may reach a point of diminishing returns and reduce the benefits, but you will not make a cell worse than when you started. How does cold laser reduce inflammation? Cold lasers can deactivate 7 of the 9 enzymes that cause inflammation by up to 70%, thereby creating a more favorable inner terrain for healing to take place. A little inflammation is good, but a lot is detrimental on many levels. Itis is the clinical name given for inflammation. Arthritis, for example, ends in itis. Cold laser therapy is FDA cleared for arthritis as it reduces inflammation, eases pain, and supports healing. Can you treat someone through their clothes? This depends on the density of the fabric or material. Some materials will diminish the amount of available light through filtering. Some materials may even be reflective to the light. For best results, it is advised to treat directly on the skin with the probe or emitter gently touching the body. This will minimize reflection and improve the depth of penetration. The further your laser is from the skin, the wider the beam will become, which increases the size of the treatment area, but also increases the amount of time needed to treat the area in order to deliver a sufficient dose of energy to the target tissue. What is phototherapy, or photobiomodulation, PBM? More recently called PBM, phototherapy is defined as therapeutic physical modality using photons, light energy, from the visible and infrared spectrum for tissue healing and pain reduction. It is considered a non-invasive, non-thermal therapy that stimulates cells to generate more energy and undergo self-repair through the use of near-infrared or NIR light, as opposed to far-infrared or FAR, which comes from saunas and heat lamps. Photostimulation is the process where a chain of chemical reactions is triggered by exposure to light. Visible and infrared light affect photostimulation in different ways. Visible light elicits photochemical changes, while infrared laser produces physical changes. With its limited contraindications and extensive clinical research, phototherapy as an adjunct modality is well on its way to becoming one of the most exciting technological innovations of the 21st century. Is higher power better? Since lasers are classified from 1 to 4, does a higher number mean it will produce better outcomes? Different power densities have different applications for health, healing, and pain relief. Power is by all means not the only factor, but higher power does create a greater energy density, which typically yields faster pain relief. Cold lasers are primarily determined to be cold if the power of each diode is less than 500 milliwatts. Some cold lasers, such as the Avant LZ30 lasers, now utilize several diodes with power up to 500 milliwatts each in order to offer more cool healing energy in a single device. Superpulsed lasers use higher powered diodes through the superpulsing but deliver low levels of average power in order to maintain cool temperatures, thus keeping at a class 1 or 2 cold laser status. Class 4 lasers use much higher powered laser diodes measured in watts, typically 6, 9, 15, 30, 45, and even up to 60 watts, to significantly reduce treatment times. However, these types of hot or Class 4 lasers are only available for practitioners or to users with an RX prescription. Correct training is needed as the extra heat they produce could be harmful to an inexperienced user. The FDA classifies lasers from 1 to 4, not due to their performance, but due to their increased possible risk of injury to the eyes. Is cold laser therapy dangerous? Cold laser therapy is generally considered safe and without complications. It is FDA cleared. There are only a few absolute guidelines that need to be followed to ensure safety and prevent injury. These contraindications include, but are not limited to, use in an open eye, over an active cancer, over the fetus of a pregnant woman, or by people with photosensitivities. It should be stated clearly that lasers in the far end of Class 3B and Class 4 ratings have the potential to overheat tissue if not properly used. What if I use the laser and the pain is worse? For some conditions, and a select very few people, this may be the case, but do not be alarmed. The laser has increased the circulation and the release of toxins. While this may cause some early discomfort, it is an indication of tissue reactivity and precedes improvement. Simply take a break from laser therapy for a couple of days and then resume at a lower dose or treat for a shorter period. How often should I treat the same person using my laser? The effects of a single treatment can last for 24 to 48 hours. Higher doses are more effective for many pain-related applications. If time permits, you can treat every day. Since the effects of laser therapy on tissue often depend on subsequent treatments, it's recommended that treatments are once a day or every other day, then taper off as healing occurs to once every 3 days and then once a week or once a month for maintenance when feasible. Where can I find the best cold lasers? Choosing a cold laser depends on your needs and budget. Prices vary wildly, but it's important to know that you typically get what you pay for. Therapeutic lasers for home use can vary in price between $2,000 to $5,000 for a high-quality cold laser. Practitioners use lasers may cost even more. Most LED devices are not as good. However, we have found a couple that are outstanding for the price of $9.95 and just $3.99 for high-performance skincare. Over 30 cold, laser, and light therapy devices can be viewed and purchased online at coldlasersupplies.com. If you would like personalized support in getting a cold laser, call a laser specialist at toll-free 888-824-7558. And for more information on Class 4 lasers, go to class4lasers.com or call toll-free 800-575-7963.